I'm Dr. Judy Gooch, and I'm a rehabilitation doctor. And I'm going to talk today about medical gaslighting, particularly in people who have had some sort of brain injury. Have you had a doctor or another provider downplay your symptoms, even imply that they're all in your head? After a brain injury, people can struggle with thinking difficulties, with poor memory, with fatigue, with irritability. A lot of times the symptoms can be vague. And I've heard at times of providers not taking these symptoms seriously. For instance, after a concussion, sometimes people have symptoms for a long time. But I've been told that providers have said, you couldn't possibly have symptoms for a concussion for this long. If your symptoms are not taken seriously, or again, it's implied that it's all in your head, you may be experiencing medical gaslighting. This is where a provider blames the illness or symptoms on psychological factors, or basically denies them entirely. Gaslighting, I've been told, is almost a form of emotional abuse. It's because it leads the person to doubt their own experiences. They start to question their own reality. They feel crazy. It can lead to depression and anxiety. As patients in the medical system, we are all vulnerable. We need to disclose personal information, and that's hard. If you're experiencing gaslighting, it makes it more difficult. Gaslighting is more common in certain groups. Women are more likely to be gaslighted. Also, if you have symptoms or an illness where there's no clear diagnostic test, like concussion, mild brain injury, then you're more likely to be gaslighted. This can lead to people seeing doctor after doctor and taking forever to get the correct diagnosis and treatment. Now, in today's healthcare system, often doctors and providers are overwhelmed. They're often expected to see multiple patients in a day. If the symptoms are complex or vague, unconsciously, they might decide maybe they're not real. I guess that's a little easier. So what can you do about it? First, try to find a provider who understands you and your symptoms. If you've had a brain injury, find a provider, a doctor, who has experience in treating people with brain injury. Also, prioritize your concerns. Like, let's say that you have fatigue and difficulty sleeping and light sensitivity and sound sensitivity and headaches and memory difficulty and irritability. Well, list those, but prioritize them. Figure out what number 1 and number 2 complaints are and start there. You're more likely to get those important things addressed if you prioritize. Think about what are those things that you most want to do to make your life better. What are the most troublesome symptoms, and start with those. Also, if you have a complex medical history, write a 1-page health summary. Because if you go to the doctor and you've got all so long health history, it can take 20 minutes to go over that, and then there's no time left to go over your troublesome symptoms. So include your diagnoses, your medications, your major illnesses, surgeries that you've had, allergies, therapies, and providers. Anything else you think is important. Also, bring a trusted friend or family member with you. They can back you up for those symptoms. And finally, remember, you can always get a second opinion. If somebody doesn't believe you, find somebody who is familiar with your condition, and you're much more likely to be understood.